Hello, welcome to the video lecture about pharmacology. My name is Oleg, and in this video we will learn about the science of pharmacology, different types of drugs, their routes of administration, drug interactions, and several exercises. You can find the timestamp of each part down in the description. So what are drugs? Drugs are a broad category of substances that can be used to treat, diagnose, prevent, alleviate, or cure illnesses. And here we have some tricky words, to treat and to cure. What's the difference? To treat, лікувати, means to provide medical care or attention for an illness or injury, while to cure, вилікувати, means to completely restore health or remove disease or injury. Treating an illness or injury may reduce the symptoms, but it may not completely eliminate the problem. Curing an illness or injury means that the problem has been completely eliminated. For example, there are different ways to treat AIDS, but there is no cure. Well, at least yet. A quick reminder, AIDS stands for Acquired Immunodeficiency Syndrome, which is SNID, syndrome набутого імунодефіциту in Ukrainian. Medications can be of biological or chemical origin and can come from plants and animals, or be synthesized in a laboratory in British English and laboratory in American English. The science of pharmacology studies, develops, and tests drugs, and it is subdivided into several fields, such as medicinal chemistry, pharmacodynamics, pharmacokinetics, molecular pharmacology, chemotherapy, and toxicology. They are described in figure 19 after the text, but let's talk about the difference between pharmacodynamics and pharmacokinetics. The etymology of the word pharmacodynamics can be traced back to the Greek words pharmakon, meaning drug, and dynamikos, meaning power. The term pharmacokinetics is derived from the Greek word kinetikos, meaning movement. The difference between pharmacodynamics and pharmacokinetics is that pharmacodynamics focuses on the power or effects of a drug on the body, while pharmacokinetics is the study of the movement of drugs in the body, that is, their absorption, distribution, metabolism, and excretion. Regarding the availability of drugs, they can be divided into over-the-counter or OTC and prescription drugs. Over-the-counter drugs are those that can be purchased without a prescription from a doctor. They are referred as OTC because they are available over the counter, через прилавок or з рук в руки, meaning that you don't have to go to the doctor, take prescription, and then go to the drugstore. You can get them directly in the pharmacy. Let's find out about different forms of drugs. Drugs come in many forms, including pills, capsules, suppositories, foams, creams, ointments, powders, sprays, transdermal patches, liquids, or aerosols, depending on the route of administration. By the way, it's route in British English and route in American English. There are multiple routes, including oral, sublingual, rectal, parenteral, topical application, and inhalation. The most common is oral, or simply by mouth, also known as PO, which you will mostly find in doctors' prescriptions. It's a Latin abbreviation which stands for per os, meaning by mouth. An alternative route of drug introduction is parenteral administration. There are several types of parenteral injections, intravenous or IV. Don't confuse it with Roman numeral 4. It's IV, intravenous. Other types are intramuscular, IM, subcutaneous, subQ, intradermal. Let's talk about drug interactions. When we take drugs, we expect them to produce a beneficial effect. But how do they produce this effect? The answer is that drugs interact with specific receptors in our bodies to produce the desired effect called response. We have to distinguish between the dose of a drug or the amount of drug administered and the schedule, that is, the exact timing and frequency of administration. Various actions and interactions of drugs in the body can occur after they have been absorbed into the bloodstream. By the way, we came across a couple of prefixes that look similar but have different meanings: inter, intra, and there is one more, infra. So inter means between, as in the word interaction, which is action between two or more drugs that changes their effects on the body. Intra means inside, as in the word intramuscular, or inside the muscle. Infra means under or beneath, as in the word infrascapular, pidlopatkovy, located beneath the shoulder blade or scapula. Let's get back to drug interaction. When you take two similar drugs together, the effect is the sum of the effects of each drug, and this is known as an additive effect. If it's lower than an additive effect, the drugs are called antagonistic. If it's greater, they are considered synergistic. There is a negative effect called iatrogenic, which refers to any adverse effect or complication caused by medical treatment or advice. It may include medication errors, помилки під час прийому ліків, malpractice, помилки лікарів, and other forms of negligence, недбалість. We have covered basic information from the text, so let's take a look at some of the exercises. In the exercise 2, you have to memorize the combining forms and their meanings and also define the meaning of the medical terms. I'm repeating myself again, but it's important to know the combining forms and their meanings, as it will help you understand and use the terms in your practice and everyday life. You can find many types of drugs among these terms, such as analgesic, antibiotic, hypnotic, narcotic, antipruritic, antipyretic, and so on. Knowing that negative prefixes a, an, or anti mean against, you will understand how these drugs act against pain, itching, or fever. If there is no prefix, it means they cause some effect or condition, like sleep or stupor. Next exercise also deals with negative prefixes. Unfortunately, there are lots of them, and there is no specific rule on how to use all of them, so you have to learn them by heart. Some of the most common ones are on and in. Several others are im, ir, il. We will talk about them in a moment. Also non, a, ab, anti, contra, dis or dis with different spelling, mal, and so on. Some words can have more than one prefix, for example, ineffective, non-effective. Talking about these prefixes, if an adjective starts with the letter m, r, or l, it will take a corresponding prefix, im, ir, or il, as in the words immortal, irrelevant, illogical. Im is also added to words starting with b and p, as in imbalance, disbalance, and imperfect, недосконалий. However, these prefixes are not always negative. Take a look at the words important, важливий, and indication, показання. Im and in are not negative prefixes here, so be sure to always check the meaning in the dictionary. The following exercise contains a short text about different names for the same drug. These names are chemical, хімічна, generic, міжнародна непатентована, brand or trade, торгова назва. Each drug has only one chemical name and only one generic name, but it may have many trade names. Here is a simple example. Acetyl salicylic acid is the chemical name for aspirin, which is the generic name, produced under various trade names, such as Bayer aspirin or any other manufacturer. I'd like to draw your attention to such phrases as public property, громадська власність, and private property, приватна власність. However, property can also mean властивість, for example, physical and chemical properties of the element, фізичні та хімічні властивості елемента. That's it. Did you enjoy the video? Don't be lazy and let me know in the comments. As always, thanks for watching. Please don't forget to share it, subscribe, hit the like button, and press the notification bell not to miss any future videos. Bye!